Welcome to Everything Cancer. This show is designed for survivors and those who love them, and to offer providers fresh perspectives and insight. Our spectrum of guests are inspiring survivors who share their journey, challenges, and how they thrive. Providers who give us insight into strategies for treatment, symptom management, and thriving through all stages of the cancer journey. Cancer care team members will give us behind-the-scenes insight into cancer care, because if you understand it better, you can be a more effective self-advocate. Leaders from cancer support organizations will share their stories and the resources their organizations provide. We'll talk about rekindling intimacy when cancer has changed your world, and we'll break down effective self-advocacy strategies into easy-to-follow steps. We'll talk about everything cancer. Thank you for listening to the Everything Cancer podcast. We greatly appreciate you being part of the Everything Cancer community. The information on this podcast is not intended to be used for medical advice. For any healthcare concerns you have, please consult with your healthcare team. The staff at Everything Cancer podcast will not be answering individual health questions. Thank you, and thank you for being here. Welcome to the Everything Cancer podcast. We have a very amazing guest with us by the name of Heather Ferguson. She is the founder and executive director of the Lymphedema Advocacy Group, which has advocated to a vast amount for people that experience lymphedema to help get them the assistance they need to have a better quality of life. I'm going to let Heather take over from here. She knows what she's talking about, and I'm just so honored to have you, Heather, spending time with us here today and giving hope and guidance to our listeners.
Thanks so much for having me, Jill.
Sure. So can you explain what lymphedema is?
Well, lymphedema is really an umbrella term for any significant impairment to the lymphatic system that results in a chronic swelling. Mm-hmm. And as the disease progresses, it's more than just simply swelling. It can result in skin changes. Patients are at a much higher risk for infection. They often have mobility issues with the function of that area of the body that's affected. And it really, left unchecked, it is progressive and can become very severe to the point of being disabling and life-altering. But although there's no cure, there are very effective treatments to manage the disease. And in doing so, patients can live a very high quality of life. So it's just really important for patients to have access to the tools they need to manage their lymphedema. Yeah, so I think, everyone has some experience with swelling. And so it's easy to dismiss it as, oh, it's not that bad, because typical swelling goes away eventually, and it doesn't get worse and worse and worse over time. And that's not the case with lymphedema swelling. It does have to be kept in check.
So I'm sure there are a lot of people that are listening that are like, that's me. That is me. And I can't wait to hear more. So can you described a little bit, but can you touch a little bit more on how lymphedema can affect a person's quality of life?
Well, as I mentioned, it does impact their immune system. Your lymphatic system is part of your immune system. So speaking from a personal perspective, I have a son with lymphedema, and I think the biggest impact for him is the being prone to cellulitis infection, which is a skin infection. Anyone can get a cellulitis infection, but they're much more serious for someone with lymphedema. They can come on out of the blue for no apparent reason and spread very rapidly, and the patient can quickly become septic. So it's something that you always have to be on the lookout for, and can really become very serious very quickly. So, in his case, I would say that's one of the big impacts on his life. But as I mentioned, the swelling can be severe enough to limit mobility and function. So some patients also have difficulty with daily activities of living, just because the swelling is severe enough and chronic that it impairs those functions. So it's a disease that can affect you in so many different ways, so many different parts of the body, and so many different levels of severity. There's not really a one catch-all way of describing it, because it affects so many different people in so many different ways.
Right. I saw a post a couple weeks ago from someone who had been treated for head and neck cancer and does lymphedema therapy to avoid the swelling due to the lymph nodes that were removed there. Women that have breast cancer and had surgery or radiation therapy often experience swelling in one or both of their arms, depending on the affected side. People that have lymph nodes affected in their groin, their abdomen, can have effects in their legs, and that can make walking painful. It can make it very difficult, and the the need for continual treatment makes treatment at home makes it much easier to stay on top of it and stay with it to keep the symptoms managed. So, and thank you for introducing us to your son, Dylan. And he's very lucky to have you as mom. So, who's been such a strong advocate for him. So, can you tell us why you founded the Lymphedema Advocacy Group?
Yeah, so it was a little bit of a struggle to get my son diagnosed, but eventually we did. And then he began therapy. And when he was 7 months old, he was prescribed his first compression garment. And we knew that this is what he would need to wear daily for the rest of his life to manage this condition. And our insurance company denied it. So naturally, my first reaction was, oh, it's probably just a mistake. We need to resubmit the claim. Well, no, it wasn't a mistake. And I quickly came to learn that it wasn't even an issue just with our insurance plan or our insurance company, but a widespread problem that most people did not receive coverage for their lymphedema compression garments. And that this stemmed from the fact that Medicare didn't cover these supplies, and most other policies follow that Medicare precedent.
Yes.
So for me, it was just adding insult to injury. It was unimaginable that my insurance company was telling me that they weren't going to cover the medical supplies that my son needed to live a healthy and full life. And it was just completely unacceptable to me. So I spent 9 months appealing that first denial, only to be granted a year of coverage for his garments. And so I said, no, this can't continue. I can't do this for the rest of his life. And I certainly don't want him to inherit this problem. So I felt, I couldn't change the fact that he had lymphedema, but I could make it easier for him to live with by making sure he would at least have insurance coverage for the treatment supplies he needed. So that was my very personal motivation to start this work and to found the Lymphedema Advocacy Group.
Well, thank you. And I'm sure you were up against an even tougher barrier with him, because he's continually growing. So you need to continually have the garments, as opposed to an adult. You need to have the garments continually change to match his growth rate, which you hope is a robust one. And so I'm sure that was a continual argument as well as for any other children that are still in their growth stages experiencing this.
That's right. He wasn't just wearing out his garment as any patient would. He was outgrowing them.
Right.
And so their delay tactics of, if it would take weeks or months to get them approved, well, then the garment, the measurements that they took for the garment, they're not even any good anymore. And you have to start the process all over again. So it was very frustrating.
Right. And then when you resubmit with a new measurement, it starts the whole thing all over again. And so, my gosh. So what have you seen change since, as far as coverage goes and the kind of issues we're talking about right now, since you started the advocacy group?
Yeah. So my son was born in 2006. I founded the Lymphedema Advocacy Group in 2010. And in the years in between, I actually worked with my state representative to first get a state lymphedema treatment mandate passed. I live in North Carolina. A couple other states also have a similar law. And those state laws require private policies based in that state to cover lymphedema treatment supplies. But state mandates are limited to private policies. If you have a self-funded policy, they don't apply to that. There's all sorts of things. So I knew all along that the big fix was closing the Medicare coverage gap. And so that's what I started working on in 2010. I went to my then congressman and explained the problem, and he agreed to introduce the first Lymphedema Treatment Act bill into Congress, which would create a benefit category for Medicare to cover these supplies, which was the reason that they had not been covered was, as you know, the garments typically last about 6 months, but DME, durable medical equipment, generally has a longevity requirement of 3 and sometimes 5 years. So we couldn't meet the longevity requirement to be covered under the DME category. They didn't consider them a prosthetic or an orthotic device. Obviously, it's not a pill. It didn't fit into any of those benefit categories. And with the Medicare program, they have to follow the letter of the law, not the spirit of the law, is what we were told. So the only way to change the letter of the law was to have Congress legislate a benefit category for these items, which is eventually what happened. So we spent nearly 13 years. The Lymphedema Treatment Act was first introduced on February 23rd of 2010. The bill became law December 23rd of 2022. So 12 years and 10 months to the day to pass the federal bill that eventually created the new Medicare benefit category. That new coverage went into effect January 1st of this year.
Wow. Something that is so obviously medically necessary is denied because of semantics.
Yes. Yes, very
that is, and it also, not only is it medically necessary, but it causes all kinds of other health issues like you were talking about that cost us as taxpayers more money and create a really adverse effect on quality of life and the ability to work, the ability to participate in life. So that's astounding. That's astounding. And I'm sure it was astounding to you in 2010. And you're like, but it doesn't meet common sense.
Yes. And that's a reaction we even got with congressional offices from very early on. It doesn't make sense. Like, these are clearly medically necessary. There is no argument here about whether or not this is cosmetic or experimental. It was the standard of care for decades already. But like I said, they were bound by the letter of the law. And as everybody knows, it takes a long time to get things through Congress.
Right.
But that argument you mentioned about the cost of not treating lymphedema properly was very powerful for us and did help us to get the bill passed ultimately, because obviously there is a new and added cost to covering something that was not previously covered. But eventually there were enough studies that we could take those studies to a healthcare analytics firm and have them actually calculate what could be saved through prevented complications and hospitalizations if patients had the tools they needed to better manage their disease, and could demonstrate that it would be an enormous savings to provide this health care.
As an oncology nurse and as a case manager, I complete and case manager both in the acute care realm and in the insurance realm. I can honestly say through observation that it's a no-brainer. The cost of the lymphedema treatment versus the cost of treating all the other issues that occur because of it, the treatment is so much less. It keeps your people working, active. The mental health benefits from a self-image standpoint, but also the physical activity not being restricted because of the disease. There's just so many other things that feed into this that really would decrease the cost of care significantly for this population and increase their quality of life significantly. I mean, that's win-win. And it breaks my heart it took you 13 years to get this through, but thank you for all the hard work that you've done and not giving up.
Thank you. Well, it was worth it. I would do it again in a heartbeat.
I'm sure. So how have things changed since the act was finally came into fruition the beginning of this year, 2024, as far as coverage, and where do we still need to go?
So the coverage has actually only been in effect for 4 months. So we're
Yeah.
really very early into this phase of seeing the changes. The Medicare coverage did start on January 1st, though. And one of the very important parts of the process was that the implementation phase last year, we worked with the Center for Medicare and Medicaid Services as they wrote the rules that would provide the details of the coverage. So, coverage for one garment a year wasn't going to provide the intended benefit. So it was really important that the rules allowed for enough garments and to replace them frequently enough before they were worn out and became ineffective. So the Medicare rules stipulate that patients can get 3 sets of daytime garments every 6 months and 2 sets of nighttime garments every 2 years. And the word sets was really key because we wanted to make sure that they didn't set the limits based on the number of pieces, because one patient might need just a single piece, maybe just an arm sleeve. Another patient might need 4 or 5 or 6 pieces to wear every single day.
Right.
And so it was important that they set those allowable quantities based on sets of garments, not the number of pieces, to make sure that the patients who had more severe cases or more parts of their body affected, that they would still get the quantities that they needed. So it's really too early for us to know exactly how many other insurance plans besides traditional Medicare who've already adopted the coverage. But of course, that is the goal, that the Medicare precedent will eventually result in all other policies providing this same level of comprehensive coverage.
I'm sure they were all watching it very closely, and hopefully they're adopting it quickly to make their cost less, but also improve the quality of life of their members who need these. So, in working with Medicare, were provisions made for children and their frequent need of changes?
No, because typically children would not be on Medicare. Now, there are, of course, adults under the age of 65 on Medicare due to disability, but children
Right.
wouldn't be on the Medicare program. However, there are medical exceptions. So anyone of any age who is a Medicare beneficiary, if there is a reason that those garments need to be replaced sooner than the 6 months, there are provisions for
Okay,
that.
good to know.
Yeah.
How about the home compression garments that are on the progressive compression therapy machines? Are those covered under this?
No, because those were already covered as accessories to the pneumatic compression pumps, which have
Okay.
long been covered. They are a classic piece of DME equipment that lasts years. And although the fabric portion, the sleeves that go along with the pump itself, might need to be replaced sooner because they're like an ancillary supply to the pump, those were already covered. And there was no reason to include them in the bill because they already had a benefit category. So we are frequently asked if the Lymphedema Treatment Act changed coverage for pumps or surgeries or the number of allowable therapy visits. And no, it did not change the coverage for any other treatment supply or treatment service, because those things already fall under their own benefit categories. So because this created a new benefit category, it is completely specific to compression garments and supplies that would fall under that new benefit category.
Right.
But one of the things we haven't touched on yet are the bandaging supplies, which of course are necessary when a patient is first diagnosed and begins their treatment, to reduce the swelling as much as possible before they're fitted for that compression garment. So we were very pleased that the bandages would not only be covered, but they're covered without restriction on the quantity of coverage. Because again, if you're wrapping one arm, that's a far lesser amount of bandaging supplies than you'll need than if it's 2 legs, for example. And the length of time a patient needs to spend doing that intensive reduction phase of treatment also varies greatly. If they are a cancer survivor, typically they're on the lookout for lymphedema because they know it's a potential consequence of their treatment, and it's often caught much earlier than a patient who say has primary lymphedema or lymphedema from another cause where it often has gone undiagnosed or misdiagnosed, sometimes for years. So they're in a very severe state by the time they are properly diagnosed and referred for therapy. And so they're going to need a much longer amount of time going through that intensive reduction phase and needing consequently much more bandaging supplies.
Right. So the bandaging supplies in the intensive reduction phase, while I'm not an occupational therapist who's an expert in this, that is like the progressive wrapping up a limb or up a body area with bandages that are similar to ACE bandages that provide compression in a safe manner to move the lymphatic fluid back toward the center of the body where it can be processed and out of the limb. It is very intensive because you have to do wrapping in a manner that causes compression but does not cause injury, and it needs to be changed often. It makes perfect sense that you want to get it reduced as much as possible before you're fitted for a garment, because you want that garment fitted to an optimal size for that person to have decreased symptoms and a good quality of life and decreased risk for infection and so on. And I see the total advantage of having the garments for someone who's at work every day, going to school every day, in sports and so on. Wearing that garment keeps that area compressed and keeps swelling from occurring.
And I will also want to point out, you mentioned limbs, and lymphedema is most commonly in the arms or the legs, but it can be anywhere in your body. And that was another really important goal for us as we were negotiating to create the rules for the coverage, to make sure that the coverage wasn't just for arms and legs, but it was for head, neck, torso, anywhere in the body that the lymphedema can occur, to make sure that they got the same level of access to treatment supplies as someone who had it in their arms and legs. Because right now that actually is a problem with the pneumatic compression pumps, which are often covered just for arms or legs, but not lymphedema in other areas of the body. So that's an example of a place where continued advocacy is needed to improve the coverage.
So what is your future vision of lymphedema coverage through Medicare, Medicaid programs, and private insurance programs?
Yeah, so we're really pleased, as I've said, with the rules for the traditional Medicare, with the allowances, the being calculated in terms of sets and stuff. So the most immediate goal is to make sure that all of the Medicaid plans, as well as the Medicare Advantage plans and the private insurance plans, adopt that same level of comprehensive coverage. And that could be that will be, I don't want to be too optimistic, that will be a multi-year process as well. We would like to think, they saw this change coming last year and they were ready to, adopt it January 1st, 2024 as well. But that is not what happened. So many of these plans and policies, they're just learning about it this year. So by this time next year, we should have a much clearer idea of which plans have adopted the coverage and which plans have not. And then we can plan some targeted advocacy with the groups or the states or the insurance company, whatever it may be, who has not adopted the coverage, and reach out to them really with the same kind of data and information that we provided to the members of Congress to explain, this is medically necessary. This is greatly going to improve these patients' quality of life, and it's going to save you money in the long run.
Yes.
Because we find that, most lack of coverage is rooted in ignorance, honestly. They think lymphedema, swelling, what's a little swelling? We don't need to worry about this, but they do. And they need to understand the consequences to the patient and to their bottom line of what's going to happen when that patient no longer can work or ends up in the hospital with an infection or whatever it may be. So I have no doubt that there will be more advocacy that needs to occur to make sure that eventually every person on every type of insurance plan has this level of coverage.
Thank you for all you've done, Heather. My gosh, it's mind-boggling and it's amazing. And I'm so thankful. I'm sorry your son is going through what he is, but I'm so thankful that you are there and you are this voice for everyone who has experienced this and finally is receiving relief through you. So thank you. If someone is currently having their garments denied, or say the midline, the torso or head and neck compression devices through the pneumatic pump denied. What are some strategies you can suggest for them to try and get coverage for that?
Yes. So there's a lot that people can do to be proactive.
Mm-hmm.
First of all, we do have a denial reporting form set up on our website.
Mm-hmm.
And so we hope that everyone will share with us when they are denied coverage or receiving an insufficient level of coverage, because that's
Mm-hmm.
the information we're going to need, like I said, in the future, to know where are the gaps still remaining so that we can address them.
Mm-hmm.
But then in terms of advocating for themselves, you should always appeal. Always appeal. I mean, so often the insurance company has nothing to lose by denying and seeing if you're even going to take the time and energy to appeal. So you should appeal as many times as you are legally allowed to.
Mm-hmm.
From my personal experience with my son, before I got these laws passed, I was always able to eventually get his garments covered, but I had to put in the time and energy to appeal it as much as was necessary to win. So definitely appeal. If you are a traditional Medicare beneficiary, you can take your appeal all the way to an administrative law judge, and many patients did prior to the Lymphedema Treatment Act going into effect, and many patients were. The ruling was in their favor.
Mm-hmm.
So it definitely behooves you to follow up on it. If you have private insurance, I would recommend reaching out to your state department of insurance. Again, this is something that I did many times. They typically have ombudsmen who can help with your appeal. And the insurance companies are a lot more receptive when they're hearing from the State Department of Insurance, not just
Sure.
you.
Right.
And
Right.
so that is another tool at your disposal. If you get your insurance through your employer, enlist the help of your HR department, especially if you have a self-insured plan. They have a lot of leverage. They are basically the paying for the policy, and they can dictate what the policy does and does not cover.
Right.
There's a lot of leverage there. If you have a self-funded plan, and your employer will advocate for you as well.
And you can take those articles on lymphedema treatment to your HR department if it is a self-funded group and say, it's going to cost you less to cover these than not.
Yes.
For the evidence that's out there. And we really want to feel well. We want to be able to participate in life and not have this experience of this continuous discomfort, risk for infection, worsening symptoms that the garments and the compression devices can cover. And I agree with you. It is probably a lack of understanding, because I think if people understood it, it wouldn't be a question. And so being able to enlighten people that can advocate for you is huge. I would imagine also maybe your local district congressional person can help too if you go to them. I do like the idea of going to the State Insurance Commission.
All of the information that we used to get this bill passed is available to people through our website. So
That's
all
great.
the studies, the data, the analysis to show how much that could be saved through reduced hospitalizations and infections is all on our website, and people can download that, take that to their insurance company or their employer,
Right.
or whoever it may be, to support their case. And we're actually going to be building a new website later this year, and we'll try to make it a little bit easier for people to find these resources to self-advocate. So right now they are under the section of the website that had congressional information for supporting passage of the legislation, but we would like to have a dedicated area on the new website that is just for assisting patients with their appeals, so they can have all of this kind of information at their fingertips to support their appeals.
Your website right now is amazing, frankly, and it's so full of detail and so helpful. And so that's Lymphedema Treatment Act.org. I'm going to have a link to it in the episode notes, and so that you can go right there and, as Heather said, find everything you need to find. And will your new website have the same name so people can find it?
So the new website, we have already purchased the new domain, will be Lymphedema Advocacy Group
Okay.
However, right now that will redirect people to Lymphedema Treatment Act because that is the site that's currently up. But when we have the new site up, it will be at lymphedemaadvocacygroup.org. But anyone who still visits the old URL of Lymphedema Treatment Act will get redirected to the new site. So you will find us either way. But now that we're no longer specifically focused on the legislation, we wanted to make the website address, broader to reflect, our new work.
How does it feel to have had this act passed?
Sometimes still a little surreal, to be honest. 13 years, it was such a long time in coming. Some days it still feels like it's still sinking in that we did it. And because there's still more work to do, it's not like it was the end. It was just the start of a new phase of advocacy.
Do you have a need for volunteer help with this?
Yeah, so we are an all volunteer organization.
Okay.
So there is always the need for more people to get involved. When we were working to pass the bill, it was very clear how everyone could be involved. We needed every single person at that point contacting their own members of Congress. So things have changed now that we're not working on passing the bill. So the ways that we need people to get involved and help are different, and they're still very much evolving right now. But we definitely do need help because we are an all volunteer group. And even if we weren't an all volunteer group, the patient voice and the constituent voice is so important. I think that people tend to dismiss their own value. They think, well, I'm just me. I'm just one person. I'm just one patient, whatever. But it's all of those individual patient voices that really make the difference. If this had been a change that was trying to be made through like the manufacturers or the distributors of these products, it would have been viewed as, well, they just want to sell more and increase their profits. But this was really a patient-driven effort. And really that has the most strength to get things done. And our collective voices are extremely powerful, but even one individual voice can be extremely powerful. And so I hope that anyone listening will not discount the impact that they can have to not only help themselves, but help millions of other patients if they're just willing to get involved. One of the ways that people can get involved is just by sharing their lymphedema story. So we have over 1,500 stories at this point because we've been collecting them for over a decade. But it was those patient stories that really touched the hearts of the lawmakers who had the power to pass this bill. The facts were compelling. The amount of money that could be saved were compelling, but the personal stories were really motivating to them. And when the bill eventually had its hearing in Congress, some of the lawmakers actually read from the personal stories that they had received from patients because they were so moved by them. So we are still collecting those stories because there's more advocacy to be done. So the policies that have not adopted the Medicare coverage need to hear those patient stories from their policy holders, for example, or if it's a state Medicaid plan, the state lawmakers need to hear from the constituents who are not getting the health care they need through their state health care plan. So that is one way that everybody can get involved as a starting point. And that's a really good thing to do first because many patients have not really talked about their experience. So we hear from people afterwards that say, wow, that was really therapeutic for me to write my story. So it's a good starting point for getting involved because you have to get comfortable talking about your personal experience. And for most people, myself included, the first time you share a lot of extraneous details that are not, that make your story very lengthy. And you find that by telling it more and more over time, it gets much more condensed and impactful. And, when you're talking to a lawmaker or an insurance company, they've got a finite amount of time to read that story or listen to you or whatever. So really having that almost like elevator pitch kind of concise statement about why this is important to you, why you need it for your health care and your quality of life is really important. And so by writing that story, it starts to help you hone those communication skills of how to really effectively advocate for yourself and others.
I agree. And I love that term elevator pitch. That is such a helpful term when you are trying to put something together. How can you share the story effectively in the time it takes to take an elevator ride with that captive audience? And so if you can get it boiled down to that, you've got it made. What is one of the most inspiring stories you have come across through this, Heather?
Oh my gosh, there's so many.
I'm sure. But it's one or two.
If someone's listening and I'm not sharing their story, I'm sorry, because there's just been so many over so many years. But one of the stories that's always top of mind for me is we have a patient who has her lymphedema is very progressed to the point that she is in a wheelchair. And, this is during the phase when we were trying to contact the bill, and it was very important that we just had as many people as possible writing to their members of Congress, urging them to co-sponsor the bill, get it scheduled for a hearing and a vote and all that. And she actually asked some of her local businesses if she could set up a table outside the front door, just like you see the Girl Scouts selling cookies, like outside the grocery store front door, so that she could talk to people about this. Just not people who necessarily had lymphedema themselves or even knew anyone with lymphedema, but she knew that the volume of communication going to those members of Congress were important. So she set up a table day after day with a sign that said, "Please come talk to me. I'm not selling anything and I'm not asking for money." And she sat out there and she educated people about lymphedema and asked them to contact their members of Congress. We had another woman who used to travel the country in an RV every summer. Her and her husband were retired, and every time they parked the RV, they had a sign made that covered the entire front window of the RV that said, "Ask me about lymphedema." And she would literally educate people about lymphedema and the work we were trying to do everywhere she went. And we used to post on social media, "Where's the lymphedema bus going next?" And so our advocates would sometimes drive, if she was close enough to them, to meet up with her on her journeys. So I don't know, just things like that, people going above and beyond, putting themselves out there, because it can be uncomfortable for people to talk about something that's so personal and healthcare related. So it takes a lot of courage to do that. And so I really want to commend all the advocates, thousands and thousands of them, who have done that over the years to make this kind of change possible. I mean, part of the reason it took 13 years is when we started going to Congress, they were like, "What? Can you spell that for us?"
Right.
Like, no one had ever heard about it, because it's not part of the public conversation, even though many more people are affected by lymphedema than ALS or all these other diseases that are very commonly known amongst the general public. Lymphedema affects more people than that, but we don't talk about it. And, part of that is the lack of awareness and education within the medical community, but it's also, I think, partially because it's something that patients feel shy and maybe embarrassed about talking about. Most patients try to hide their lymphedema, frankly, under their clothes, if it's a part of the body that they don't have to expose. And so I really commend the patients who stopped hiding and were willing to talk about it.
Thank you so much for sharing all of this, Heather. And I cannot thank you enough for what you have done on behalf of everyone who has experienced lymphedema and unfortunately will be in the future. You have changed millions of lives single-handedly. I know you had a groundswell of people behind you, but you're the one who got this started. And I'll never forget this conversation. Thank you so much.
Oh, you're very welcome. Thank you for having me. And I hope that people will visit our website and share their stories, get involved with the future advocacy actions where we will need people again stepping up to make these kinds of changes to improve patient care.
I absolutely. Is there anything we haven't covered yet that you feel is important to cover?
No, I think that's everything.
Oh, good. You have a winner smile, and it's just been an absolute pleasure to have you here with us today. Thank you so much.
Thank you. It was my pleasure to be here and talk with you. Thank you for having me.
Absolutely. We hope you enjoyed this episode of the Everything Cancer podcast. If you would like to show your support, there are links in the show notes to do so. The information in this podcast is not intended to be used for medical advice. For any healthcare concerns you may have, please consult with your own healthcare team. The staff here at Everything Cancer Podcast will not be answering individual healthcare questions. Thank you, take care, and we'll see you back for the next episode of Everything Cancer. Bye-bye.